Good afternoon. Welcome to the weekly briefing here at the EMA office for day 502, week 7. It's a Wednesday afternoon. I won't say it's a good afternoon because when you look at these numbers, there's nothing really to be good about. Joined here with Chairman Mark Kern today and also Mila Blanford, Director of the Health Department. Mila, the numbers are not going the way they were.
No, we're going the wrong direction for sure. Not just us though, everywhere, unfortunately. For July 22nd through July the 28th, we have 633 new positive tests out of a total of 6,528 for the reporting period. The age range of positive individuals is under 10 to in their 80s. The weekly county positivity rate is at 9.7%, matching the 7-day rolling average at 9.7%. The regional positivity rate as of July the 25th was at 9.1%. Unfortunately, we do have 4 new deaths to report, males and females from their 60s to their 80s with both known and unknown health conditions. Countywide, we have conducted a total of 395,235 tests, consisting of 33,221 positives and 362,014 negatives. The total number of deaths to date is 490, and our condolences go out to those families. To date, the number of individuals who have completed the 10-day isolation period is at 31,914. Statewide, we've conducted a total of 26,720,742 tests, consisting of 1,415,572 positives, which is an increase of 11,606 from last week. Total deaths to date is 23,420, and that's an increase of 28 from last week. For St. Clair County hospitalization numbers, the number of COVID-related hospitalized patients in St. Clair County is at 39. Regionally, we're at 79. Patients on ventilators in St. Clair County is 2, and regionally we're at 6. For congregate care, those in outbreak status announcing only new cases: Mercy Rehab of Swansea, 1 new case; Brea Belleville, 4 new cases; Cedarhurst of Shiloh, 1 new case; Freeburg Care, 1 new case; and Integrity Smithton, 4 new cases. We continue to offer testing at St. Clair Square Monday, Wednesday, Friday, and Saturday from 8 to 4, as well as HSHS on Hartman Lane, CVS, MedExpress, and Walgreens. We continue to offer vaccine at 330 West Main Monday through Friday from 10 to 6 and Saturday from 8 to 4. There are a lot of other providers in our county who offer vaccine. You can go to our website, our social media to find out that information and how to register for an appointment. We continue to offer mobile clinics throughout the community, so if you're interested in hosting one in your community or for your business, your employees, you can go on the Health Department's Facebook or website and sign up for a mobile clinic. Or you can reach out to our call center at 825-4447 with more questions. They're open Monday through Friday from 8:30 to 3:30. Dr. Ezeki will be hosting a town hall in our region on Thursday, August the 5th at 6 p.m. We'll push more information out as that becomes available. We've had 2 new variants identified, B1 and B16677.3. You can go to our website for more information about the variants that are circulating out there. Obviously, the big variant of concern right now is the Delta variant. We know that it spreads twice as easily as some of the other variants between people. And right now, it's the predominant variant for those that are typed. Around July the 4th, it accounted for about 50% of the variants that were typed. As of last week, it was about 83%, so you can definitely see an increase. When we look at trends in hospitalizations for last month in June, statewide, some of the trends were that 90% of people in the hospital for COVID were unvaccinated. Almost 10% of people in the hospital with COVID-19 were under the age of 30. Half the people in the hospital with COVID are between 30 and 59. Almost 1/4 of the people in the hospital with COVID were over 70. More men than women were hospitalized, and 6 out of 10 people hospitalized were people of color. So that was some statewide trends that were observed for June, and obviously we know those numbers have increased since then. We do know that new masking guidance was released. If you go to our Facebook or our website, and I believe Brian will be sharing that information on the St. Clair County EMA page as well, you can get copies of the information that's been released. We've had a lot going on. Monday night, the new school guidance was released. Tuesday, CDC and IDPH came to agreement that CDC recommends that everyone, including fully vaccinated individuals, wear a mask in public indoor settings and in areas with substantial and high transmission. So in St. Clair County, by CDC metrics, we have a high level of transmission. And Randy, do you want to pull up that CDC tracker that we talked about? So if you go out to our guidance document, there's actually a link, or you can just Google CDC data tracker. go to the county view. Okay. Now we will be posting that transmission level for the community in our graphic that we post every day with our daily stats. Again, Brian's sharing that, so you could just go to the EMA page or the health department page to pull that up. But there's a lot of good data on CDC's site for both vaccine and different data, just so you know where it's coming from. But if you select your state and your county, and I will say for county level data, CDC is typically more current than IDPH, so that's something else that's good to know. You can see the color gradations, and this is the transmission, and in St. Clair County we are red, so that is high. Now if you want to scroll down and go to the footnotes and different data, there's some statistics that they provide there showing our fully vaccinated rate, which is about 42.5%. Our one dose is 55.6% for St. Clair County. And then if you go farther down, you can select on different data and get exact case rates, which CDC has us about 188 per 100,000, which is why we're in that red level. Now I do want to stress that it is important that you go to the CDC data, and I don't want to confuse anybody, but I just want to make sure, because if you're going on IDPH's site and you're looking at school metrics, there's similar transmission data that has different terms, and IDPH will be updating that terminology to match CDC. So when we're looking at community transmission, you should be going to the CDC page, which is the one that we just showed you on here. And again, that information will be daily in our graphic with our percentage rates. Okay? All right.
So Mila, the 55% fully vaccinated, we do know that there is a certain possibility that that number is too low, because we do know of people who have been vaccinated in St. Louis or in Missouri, and that number doesn't necessarily translate into Illinois statistics.
So we're at 42.5 for fully vaccinated, one dose is at 55, and that was the CDC data. Illinois is working with Missouri in order to pull that data over, so a lot of our folks may work at a Missouri health institution where they receive vaccine, so that those numbers can be updated, and I know that that's something they're actively working on.
Because we do know that we vaccinated a heck of a lot of people at the fairgrounds, but there were people that accessed vaccine in other places, so we'll need to keep track of that. The reason for the CDC bringing back the mask requirement, and they're asking people to wear masks in public settings, we have gone from 5% a month ago to now, today we're at 9.7%. So the mask really is the mitigation that they're recommending to try to get these numbers to go back down, right?
Right. With a layered approach, obviously you have to wash your hands if you're uncomfortable, socially distanced. If you're immunocompromised and you've been fully vaccinated, wear a mask. Obviously, data also changed in that prior to today, they were recommended for fully vaccinated people that if you had an exposure to a COVID positive person, unless you were symptomatic, you didn't have to quarantine, you didn't have to test. Well, in today's guidance, if you're fully vaccinated and you have an exposure to someone who is COVID positive or you believe is COVID positive, they recommend the testing at 3 to 5 days, and that you're wearing a mask in that time frame so that you're not spreading. And a lot of this is being attributed to that Delta variant and the ease of spread.
And these variants are coming about because people who are not vaccinated are incubating this virus and creating these new variants. You named two additional variants, I think, that we've seen in the county. Are these as nefarious as the Delta variant, or are we seeing perhaps they won't be as contagious or as deadly?
At this time, they're not to that level. One is a variant of interest and one is a variant of concern. So right now, the focus is on the Delta, especially with the spread that we're seeing. And if you go out on that COVID data tracker sheet on the website that we just pulled up, you can see the red in the areas throughout the United States where you're seeing those high levels of transmission. And they are also attributed to low vaccination rates. Now, we're about 42, 43% in our county, which is considered a moderate level of vaccination. But they are saying that this is an epidemic of those who are not vaccinated.
And a variant means that this virus is different than the virus we dealt with when we sat here a year ago. That this is worse for all of us. And do variants continue to get worse, I assume?
Well, it depends on what that mutation is. This one tends to spread more easily. which is why they're so concerned about it. But each variant has its own pluses and minuses. And again, we've shared some information. CDC has good information. IDPH has someone as well. There's a lineage link that we're sharing on the health department's website that really breaks all the different ones down and gives specifics about where it was first seen and different information. So if you're interested in that, because there's a lot of information out there, I encourage you to look at our Facebook or our website for more information.
And we're still giving vaccinations at 330 West Main,
We are.
and all of the vaccines we give provide protection against the Delta variant.
Correct. Right now we're running Pfizer every day, 6 days a week, Monday through Friday from 10 to 6, Saturday from 8 to 4. You can drive up at any time during those hours to receive Pfizer. We do Moderna and J&J by appointment. Our next J&J, I believe, is next week. But if you go to our website, you can look at what's available and when.
One question, Mila. As we sit here today, and as we, the last couple of weeks, we've had some of the finest physicians on. As you sit here as the head of the health department, some comments on here about how awesome the report is and everything you're given. How concerned are you where we are right now with these numbers increasing?
I'm very concerned. As we move into fall, we know the incidence of respiratory illness will increase. We're obviously seeing the COVID numbers go up. We've heard that there's more RSV right now, which is atypical. And we don't know what the flu is going to look like this year. Last year, we had a reduction in flu numbers across the board, and we don't know if that's going to be the case this year.
I also don't remember, and Brian Whitaker prints out the reports for us, but I never remember a report that here we have about 45 days where we went up every day. I mean, it went from the first day on this report is the 16th of June. We were at 2.5%. Now we're at 9.7%, and it's just a continual increase. Unless we put mitigations in place, these numbers are just going to continue to go up.
That's a natural course. As we move in fall, people move indoors. We see more respiratory illness during that time naturally.
So we ask that people mask up if you're around people with immunocompromised systems, elderly. We really need to start to wear masks again when we're with people that have issues, and certainly we're going to move into using the CDC requirements and recommending them, and we sure appreciate, Mila, you being here today with the information. So we've got the zip code reports. Remember, these are what's happened in the past week, and the picture's pretty bleak. We have one zip code that didn't change. I think that's Summerfield, and everywhere else we have pretty big increases. So 62059, we're up 3 to 48. 62201 went up 28 to 683. 62203 up 20 COVID positives to 749. 62204 went up 18 to 496. 62205 up 14 to 769. 62206 up 60 to 1,646. 62207, we went up 35 people to 762. 62208, up 31 to 1,902. 62220, up 44 to 2,374. 62221, up 58 to 3,154. 62223, up 39 to 2,037. 62225 up 9 to 181. 62226 up 65 to 3,642. 62232 up 12 to 984. 62239 up 12 to 541. 62240 up 3 to 185. 62243 up 8 to 826. 62254 up 8 to 859. 62255 up 1 to 92. 62257 up 2 to 373. 62258 up 15 to 1,166. 62260 up 8 to 869. 62264 up 5 to 390. 62269 up 76 to 3,707. 62282 up 2 to 75, And finally, 62285 up 6 to 615. County 7-day rolling average today, this week, today's average is 9.7%, and the regional positivity now is at 9.1%. Herb, the numbers, they're not headed in the right direction. People need to get vaccinated, or we're going to continue to have these numbers go up. Eventually, a variant is going to be created that's going to break through in a serious way the current vaccine. If that happens, we're back to where we started 502 days ago.
Well, and as I said just a few moments ago, we've been here every week. We've had the finest physicians come on, the health department, Team St. Clair, everybody. At one time, just like today, out of 27 zip codes in the county, 26 of them had increases. Just totally the opposite of what it was about a month ago. We was only reporting 1 or 2 zip codes. So that's how quick this thing is spreading again. And for those of you, and I'm not talking about those who are on here today, the loyal team members of Team St. Clair, but you all know people out there that probably hasn't been vaccinated. And as you heard the doctor last week say, our best tool in our toolbox is the vaccination. You just heard Mila, you heard the chairman say that. For whatever reason, if these numbers aren't staggering to you and aren't alarming, 490 deaths in the county here, 4 more that we've had this week. It's alarming. 23,420 deaths across the state of Illinois. And for those of the people who haven't got vaccinated for whatever reason, I hope you don't wait too long. And one of your loved ones, one of your neighbors, it's too bad. I mean, you look at the ventilators, 6 in the region, 2 here in the county. It's just, it's alarming.
But we are encouraged. Mila made the point that we're getting a lot of first-time customers, people getting that vaccine. So maybe the information hasn't been out. Maybe it's taken this second spike to get people to finally decide to get that vaccine. Almost 200 million people have had the vaccine now. Everyone here in this room has had the vaccine, and there really were no problems. And we're happy that we got it. It was very freeing to get it. We would encourage all of you that haven't been vaccinated to get vaccinated if you can, because it's really the fate of all this is in your hands. The fate of how society moves forward with COVID and actually getting rid of this virus is really in the hands of people who aren't vaccinated. Getting vaccinated is really the only way that we're going to rid ourselves of this virus.
Well, this is something that we can control our destiny. I mean, each individual can control that by just making that decision to go get it, and it's easy. 330 West Main, you don't even have to get out of your vehicle. You just go there and get it. It's like the testing that's still going on out at the mall on Monday, Wednesday, Friday, Saturday. Mm-hmm. And are they there on Sunday? I can't remember. No,
Monday,
just
Wednesday, Friday,
Saturday. No excuse why. If you're not feeling good, go get tested. It's free. Not a lot of things are, but just pull up 330 West Main. Mila has the staff there that is more than willing. They're nice. They're polite. You don't feel it, and you're going to be doing yourself a favor and plus your loved ones. And that's we're going to sit here and continue to beat this horse as long as we have to, because it's the right thing to do. 502 days we've been here. We didn't want to be here anymore, but until we get people to understand that this thing is here, it's serious, we're going to be here. So we appreciate everybody, Team St. Clair, everybody that joins us. Please spread the word. Tell your friends, tell your neighbors. It's not over with. Just when we thought that light was getting dimmer, it's getting brighter now, and we don't want it that way. So we'll be back next week, unless something happens in between, for week number 8. Stay tuned to the EMA Facebook page or the health department for any changes that are coming out. Have a good evening.